Hello and welcome everyone. Thank you so much for joining us today for our webinar on best practices for reducing language barriers in the hospital. My name is Elisa Muzzi and our CEO and co-founder Maja Magnusson is here with us today as well. Hi Maja.
Hello.
So first, let's have a look at today's agenda. We will start with a brief introduction of Care to Translate, followed by a demo of our app. We will then take a look at a few customer cases to see how our customers use the app in different hospital departments. And we will take questions at the end. You can write them in our chat throughout the session, and we will make sure to answer them at the end. And now it's time for Maja to tell us more about how the Care to Translate app can be used throughout the hospital.
Thank you, Elisa, and welcome everyone. I'm glad you're joining us today, and I'm also glad you're not here for and asking for faster horses. And no, I haven't lost my mind. Please let me explain. Yesterday, I joined a 3-hour discussion on language support in healthcare with a Swedish healthcare region that serves around 400,000 residents. And healthcare professionals from various areas shared the challenges that they face and their vision for future of language support. And many were asking for improvements in interpreter scheduling or automatic cancellation when patient meetings are canceled, access to interpreters with specialized healthcare training, and so on. And they also described real issues with phone interpreters, such as interpreters taking calls from inappropriate locations, displaying bias in conversations, and other challenges that compromise care. And as I listened to these healthcare workers, I kept thinking of Henry Ford's famous words. If he'd asked people what they wanted in transportation, they would have asked for faster horses. But in a world where life expectancy has risen by 2 decades over the last century, where chronic diseases are on the rise, and where healthcare costs are soaring, communication is key. And to move from reactive to proactive healthcare, bridging language and cultural gaps with technical solution is essential. So, going back to where I started, I'm glad you're here, curious about a modern technical solution for communication across language barriers, not simply a faster horse. And that's Care to Translate. It's a vast library with medical phrases translated in 46 languages. It's available offline and online 24/7 whenever you need it, and it can be used on mobile devices such as mobile phones, tablets, and desktops. Also, we don't store any patient data. You can use Care to Translate throughout the patient journey in various departments. For example, to register the patient, to ask specific patient safety questions, but also to instruct the patient during the examination or to inform and calm the patient and tell them what is happening. After the examination, you can also give information before discharge. And to customize Care to Translate, you can use predefined templates in our platform or build your own playlists based on your specific needs, either depending on the department you're working in or maybe the role you have. And this helps you also ensure consistent communication throughout your team, no matter what language the patient speaks. And let's give you some practical examples when you can use Care to Translate. For example, when you have an initial examination of the patient, to tell them what you will examine and how, maybe to instruct them what to do. Another scenario could be when they're waking up from a surgery, to tell them what has happened, where they are, and make sure that they feel safe. Or, for example, before a radiology examination, where you probably will tell all your patients the same things, instruct them how to maybe undress or how to position themselves before they're going through the radiology examination. So with our tool, you can ensure safe and equal communication for all patients, no matter the language. And let's now have a look at our app. And I'm going to invite Elisa to show our app to you.
Thank you very much, Maya. And if the audience has any questions for Maya on any of the topics she covered, please make sure to add them to the chat so we can answer them soon. So this is our app, Care to Translate. You can see the blue icons here. These are playlists. There are like different steps or different situations within the patient journey where you need to inform, instruct, or ask questions to the patient. So depending on what sort of dialogue you want to have, in what situation you're meeting a patient, you can have a set of different playlists in the app. You can see that up here to the right, I selected a language, Danish, because I know that there are a few Danish attendees with us today, but you can switch the language at any time. I will now go into one of these playlists. I will go into the Waking Up After Surgery playlist because this is one of the examples that Maya showed on her slide earlier. And you can see that there's a set of phrases structured in a certain order, and you can revise this order, you can change it, you can add phrases from our library to a playlist, and you can remove phrases from a playlist as well. So when, in terms of waking up after surgery, you don't know when the patient will wake up. So it's hard to plan for an interpreter to be present. So it's nice to be able to inform the patient and calm the patient down when they wake up after surgery. So you can press on a phrase to translate.
Hi.
And you can see that the translation plays in text and audio formats. So you can let the patient know you have had surgery.
Du blevet opereret.
The surgery went well.
Operationen gik godt.
You have a tube in your throat.
Du har et rør i halsen.
And the tube helps you breathe.
Røret hjælper dig med at trække vejret.
You can also let them know that your relatives know you are here.
Dine pårørende ved, at du er her.
And your relatives will come to visit later.
Dine pårørende kommer på besøg senere.
So these are just a few examples of phrases you might want to say to a patient after waking up from surgery. I will now go into a different playlist. I will go onto the symptoms playlist. And here you can let the patient know, you can ask the patient, what is the main complaint you're seeking treatment for?
Hvad det primære problem, du søger behandling for?
Point to
Peg på din krop.
Point to your body. You can ask the patient, are you in pain?
Har du ondt?
And you can see that in this case, since it's a question, there are built-in answers in the app. In this case, yes, no, I don't know. You can ask the patient on a scale from 0 to 10, where 0 is no pain at all, and where 10 is the worst pain possible, how much does it hurt? Show the number with your fingers.
På en skala fra 0 til 10, hvor 0 er slet ingen smerte, og hvor 10 er den værst mulige smerte, hvor ondt gør det? Vis nummeret med fingrene.
And you can see that some of our phrases are accompanied by an image icon, and this is image support. So you click on show image and an image appears to support what I'm communicating even further. You can switch patient language at any time, clicking on the language icon to the top right. I will now switch to Ukrainian because I know that that's frequently encountered. And whenever it's a gendered language, you will have to choose whether the patient is addressed as male or female, because the phrases will vary a little bit. You can search the entire library at any point. So for example, since I'm in the symptoms playlist, if I want to ask the patient if they have a fever, I will type the keyword fever, and I can see that the question, do you have a fever, comes up from the search function, and I will press on it.
Чи є у вас висока температура?
So now the question plays in the new patient language Ukrainian. And again, I have the built-in answers here as well. Now, in some cases, you might want to deepen the conversation with a human interpreter if you'd like to ask more open questions, for example, after using the app. And you have the option to add interpreter services here to the bottom right. So I click on interpreters, and from this tab, you can add contact details. You can click on the number, and you can call directly from the app in case you would like to call interpreter services. And now I will pass it back to Maya.
Thank you so much, Elisa. And I also want to remind you, please add your questions if you have any to the chat. And I'm gonna move forward and give you some examples of where Care to Translate is being used. We have many different types of customers across 11 countries today. If I give you two examples of customers that use and utilize Care to Translate throughout the hospital, it would be, for example, Karolinska University Hospital in Sweden. And initially, they adopted it in the infection clinic during the Ukraine crisis to meet the increased demand. And the app has now spread organically to other departments, such as post-op or mammography and radiology. Another hospital would be, for example, the Oslo University Hospital in Norway. And it's probably our biggest success story. After a successful 6-month trial in selected departments, they made the decision to implement the app across all necessary departments. And now, about 18 months after the initial pilot, it is being used in over 100 departments. And it shows that the app is quite easy to implement and to start using in your department as well. And to inspire you a bit more, let's look at specific departments using our app. The mammography department at Karolinska University Hospital calls around 60,000 women for screenings each year. The problem was that only clinical patients have the right to an interpreter. And since the screening is considered a preventative measure, patients coming in for a mammogram don't have the same access to interpreters. And the mammography clinic gets a lot of patients coming in who don't speak the language and need some kind of language support, which has now been made available through the app. I don't know if you have anything to add here, Elisa. I know you recently met with the mammography department at Karolinska.
Yes, I met with the department a couple of weeks ago. And as Maya said, this is a Swedish hospital. Most staff members speak English, but Faranak, who's a radiology nurse and whose image is on the slide here, she does not speak English, and she uses the app a lot to translate to English with patients that don't speak Swedish. And she commented that she's really happy about the new content implemented in the app often, so she has a lookout for that. And she also shared that not only do they save time and costs with the app, but their patients are also very happy when they're using the app to communicate with them.
And that means, of course, a lot. Thank you, Lisa. Another example is the Ålesund Emergency Department in Norway, which is part of the same procurement agreement as the Oslo University Hospital. And the app has been instrumental in shifting their reliance from phone interpreters to a digital solution. And that has resulted in significant cost savings as well. they have reported that they save around 20,000 euros a year due to utilizing the app. And the app allows also staff to focus on medical care, ensuring clear and immediate communication, which of course is vital in an emergency setting. And the final example I'd like to highlight is the maternity services at the Royal United Hospitals Bath. And previously, the hospital relied primarily on telephone-based interpretation services, which were effective for scheduled appointments. However, this approach often fell short in urgent or unscheduled situations where immediate communication support was needed. And after a successful trial last year, during which staff appreciated the app's ability to facilitate safe and clear communication with patients, and the hospital decided to invest in a license to provide the app across all maternity services. And this ensures that they are now better equipped to support all patient interactions, regardless of scheduling. So we hope that we have provided some insights on how this simple tool can enhance the quality of care and also help give better care by having effective communication during maybe stressful situations, to help increase comfort for patients when they understand and also feel understood, and of course enable more efficiency by maintaining direct and accurate communication.
Thank you so much, Maya. And now I would like to open it up for our audience to ask questions. You can write them in the chat, or you can raise your hand if you'd like to speak. Now, I see that there are a couple of questions already. So the first question is, can you add your own phrases if we have specific sentences we often use? Maya, would you like to take that,
Yes,
please?
of course. And you just mentioned it before that the mammography clinic commented on that. So we add new content all the time. And most of the content we add is actually a request from our customers. So yes, you can request phrases to be added to the product. And we will ensure that the formulation is understood by all types of patients and also translated into all the languages that we provide on our platform. So yes.
Nice, thank you. And I see that there's another question. If staff speak many different languages, is it possible to translate from other languages as well? And the answer is yes, we can translate from and to any of the 46 languages that we currently have in our app. Now, I also know that there is a common question with our customers is, does the app replace interpreters? And Maya, would you like to say something about this, please?
Well, it all depends. It depends in what situation you would use the app. So if it's a more standardized procedure or session, for example, the mammogram that we explained earlier, then it can replace the interpreter. And in some situations, the app is used before and after the interpreter is present. So it depends on what kind of conversations you need to have with your patient. If it's more direct and close questions, instructions, information, then the app works really well. If you want to have a more open conversation, ask open questions, then we would recommend also using human interpreters. I don't know, you meet a lot of customers. Have you any other examples, Elisa?
Yes, I would just like to add that a few days ago, I met with an ultrasound department who use our app, and they are gradually replacing interpreters with the app. So they now often find that they no longer need to book interpreters because of the app. So they are gradually replacing interpreters with the app whenever possible. And I also know that there is another common question that we receive, which is when you have bad internet connection, how can you still use the app?
Yes. You have the option to download specific playlists on your phone or tablet, and then replay them in an offline mode. So you can select also the languages you would like to have available, and that helps a lot if you have a hospital with shaky internet, which we know is quite common. Then that solution is a really good one to use. But of course, you can also use it online if your internet is good. So either way works well.
Thank you. And another question that comes to mind is when a hospital starts using the solution, do you need to set up an account for all the departments, or how would that work?
Yeah, well, as I shared before, also we have it's up to you and your needs basically. So going back to the examples, Karolinska, for example, they have gradually added departments. But the Oslo University Hospital, they rolled it out to a bit over 100 departments, more or less simultaneously. And if you have a bigger need and you want to have utilize the app in many departments, our templates are really good to use because it helps you set up an account within maybe 5 minutes and you can get started. And then of course you can also optimize them after a while. But if you would just like to get started quickly in many departments, it doesn't take much more time than setting up an account for one department. So it depends how you would like to utilize the app. Maybe if you're a larger organization, you can also start maybe with some departments where you feel the biggest need, or maybe where the technical equipment is already in place. We know that radiology, mammography, ultrasound, for example, usually the stuff is quite technical and the implementation goes well because they already have a lot of technical devices at hand. So maybe that's a way to start as well.
Nice, thank you. And since you mentioned technical devices, what would you say is best to use the app on? Would you say tablets, computers, phones?
I would say whatever you have, whatever you're used to, that's the device you should go for. So we have built the solution to not be dependable on what kind of hardware you're using. We want you to utilize the equipment that you already have. If you're using it on a desktop right now, you need to use the online version. And if you have mobile phones or tablets, you can also use the offline version. I think the most critical thing is that you start using it on devices that are available and also that are already part of the daily process. So again, going back to, for example, the mammography department, we know that a lot of mammography departments are using it on a desktop because that's what they already have set up. It's easy to just open the app and start translating and playing the sound. So I think that's key. And if you don't have any digital tablets or phones available, you can also start with some like one or two for your department to get started.
Nice, thank you. And I see that someone raised their hand. Maria, would you like to ask a question?
Hey, hello. Can you hear me?
Yes, we can.
Thank you. I just wanted to hear, like, maybe from the perspective of like the patients, how do the patients feel about doctors and physicians using the app? And have you thought about maybe looking from because from what I saw from the app and so on, it's like the doctors are using it to explain what's happening to the patients. It's not the other way around, where the patient can ask questions about some procedures. So.
Well, really great question. First of all, there is a patient version of the app. So today we have demoed the medical library, but there is a patient library as well. What we have heard from our customers is that most patients are really happy when they use the app because they understand and they also feel understood. We've heard from customers that the patient wants to hug them because they're so happy hearing their own language. We have not had any negative feedback so far, but also we are most in touch with the staff members of, for example, the hospital. But I think it was a great question, and if you would like to have a look at the patient version, you can download the app for free, and you just select that you want to use the app as a patient, and then you can also see the patient library and start using it if you would have the need.
Awesome.
All right.
Thank you.
Yeah, thank you so much. Well, I think that we are about to wrap up soon. And are there any more questions, or should we move on?
I cannot see more questions at the moment, so I think we can move on.
All right. Well, thanks again, everybody, for joining us today and for caring about breaking language barriers and improving patient care. And we're really excited to offer you a 2-month free trial if you're one of the 2 first departments to reach out to us. And if you believe that Care to Translate can enhance communication and improve patient care, please talk to your organization about the trial and feel free to contact us for more details or partner with us to explore how we can support healthcare professionals with seamless communication solution. So thank you for not asking for faster horses today. Feel free to reach out to Elisa and me, and thank you.
Thank you so much, everyone, for attending, and thank you for your great questions. Bye, everyone.
Bye-bye.